Welcome to Lost Plant Remedies. There is a vine growing in the mountains of southern China that has done something no pharmaceutical company has ever been able to replicate. It has created more centenarians per capita than anywhere else on Earth. In the 1970s, Chinese researchers were conducting a nationwide census, and they stumbled upon something that defied explanation. In Guizhou province, one of the poorest and most remote regions of China, people were living past 100 at rates that shattered every statistical model. These were not wealthy people with access to advanced medicine. These were farmers and villagers living in conditions that should have shortened their lives. The researchers went looking for answers. They tested the water, they analysed the soil, they studied the diet, and they kept finding the same thing over and over again. The locals were drinking a tea made from a wild vine that grew on the mountainsides. They called it Tianchao, the herb of immortality. What the researchers discovered when they analysed this plant would trigger decades of scientific investigation, and then something far more predictable. Silence. The vine is called Jiaogulan, and its scientific name is Gynostemma pentaphyllum. It belongs to the cucumber family, and it grows as a creeping vine across southern China, northern Vietnam, southern Korea, and Japan. It has been used in these regions for centuries, but it was never part of the classical Chinese medicine tradition. It was folk medicine. The medicine of poor people in remote mountains. The kind of knowledge that empires never bother to write down. When researchers at Guiyang Medical College began studying Jiaogulan in the 1970s, they were not looking for medicine. They were looking for a natural sweetener to compete with sugar. China was trying to reduce sugar imports, and scientists across the country were analysing plants for sweet compounds. What they found in Jiaogulan was not a sweetener, it was something far more valuable. The plant contained saponins. These are compounds that create a soapy foam when mixed with water, and they are found in many plants, including ginseng. Ginseng contains approximately 28 different saponins called ginsenosides, and these compounds are responsible for most of ginseng's medicinal effects. Jiaogulan contains over 82 different saponins called gynostemma, 82 compared to 28. And here is where the story becomes interesting. 4 of the gynostemma in Jiaogulan are chemically identical to the ginsenosides in Panax ginseng. This plant that grows as a weed in southern China contains the same active compounds as one of the most expensive medicinal herbs in the world, plus dozens more that ginseng does not have. The researchers began calling it southern ginseng and poor people's ginseng, but those names undersold what they actually found. Dr. Jialu Liu at Guiyang Medical College spent years documenting the effects of Jiaogulan. His research showed that the plant had adaptogenic properties, meaning it helped the body resist physical, chemical, and biological stress. It lowered blood pressure in people with high blood pressure and raised it in people with low blood pressure. It reduced cholesterol in people with high cholesterol. It improved endurance and reduced fatigue. It enhanced immune function. It protected the liver from damage. The research was extensive, and it was compelling, and it was almost entirely ignored by the Western world. In Japan, a parallel discovery was happening. Japanese researchers had also been looking for sugar alternatives, and they had also found Jiaogulan. Dr. Tsunematsu Takemoto at Tokushima University isolated and identified many of the gynostemma, and his research confirmed what the Chinese scientists had found. The Japanese began calling the plant amachazuru, which means sweet tea vine. They started selling it as a health tea, and it became popular enough that Japanese companies began cultivating it. But something strange happened when Western pharmaceutical companies looked at Jiaogulan. They examined the research, saw the potential, and then walked away. To understand why, you need to understand how pharmaceutical patents work. A company cannot patent a plant that grows wild in nature. It can only patent a specific extraction, process, a synthetic version of a compound, or a novel use that no one has documented before. Jiaogulan has been used as medicine for centuries. Its compounds were already identified. It grows wild across multiple countries. There was nothing to patent, nothing to own, nothing to create a monopoly around. The research continued in Asia. Studies showed that Jiaogulan activated an enzyme called AMPK, which stands for adenosine monophosphate activated protein kinase. This enzyme is sometimes called the metabolic master switch because it regulates how cells produce and use energy. When AMPK is activated, cells burn more fat for fuel. They become more sensitive to insulin. They produce more mitochondria. They clean up damaged proteins and cellular debris. Pharmaceutical companies have spent billions of dollars trying to develop drugs that activate AMPK. Metformin, the most widely prescribed diabetes drug in the world, works partly by activating AMPK. The research on Jiaogulan showed that its gynostemma activated AMPK through the same pathways that pharmaceutical companies were desperately trying to target. But you cannot charge $300 a month for a tea that people can grow in their backyard. The economics did not work, so the research in the West remained sparse and underfunded, while the research in Asia continued to accumulate. Studies in China showed that Jiaogulan reduced tumor growth in mice. Studies in Thailand showed it improved blood sugar control in diabetics. Studies in Korea showed it reduced anxiety and improved sleep quality. Studies in Japan showed it protected brain cells from damage. More than 100 peer-reviewed studies exist on this plant, and if you ask the average Western doctor about it, they will have never heard of it. The ginseng industry had no incentive to promote a cheaper alternative that anyone could grow. The pharmaceutical industry had no incentive to validate a medicine they could not patent. The supplement industry in the West did eventually discover Jiaogulan, but without the ability to make health claims and without major marketing budgets, it remained a niche product known only to herbalists and people who specifically sought it out. Meanwhile, in the mountains of Guizhou province, people kept drinking their tea and kept living past 100. The centenarian research that started in the 1970s has continued, and the correlation between Jiaogulan consumption and longevity has held up across multiple studies. Researchers have proposed several mechanisms. The antioxidant effects protect cells from damage. The AMPK activation improves metabolic health. The adaptogenic properties reduce the cumulative damage of chronic stress. The nitric oxide enhancement improves cardiovascular function. No single mechanism explains everything, but the cumulative effect appears to be a body that ages more slowly and resists disease more effectively. There is something else about Jiaogulan that makes it remarkable. It is almost impossible to kill. The vine grows in poor soil, it tolerates shade, it survives drought, it comes back after being cut to the ground, it spreads through runners, and can colonize large areas if left unchecked. In some parts of the United States, it is actually classified as an invasive species, a plant that promotes longevity and is classified as a pest. The pattern should be familiar by now. Jiaogulan can be grown from seed or from cuttings. It prefers partial shade and moist soil, but it adapts to a wide range of conditions. In warm climates, it is a perennial that comes back year after year. In cold climates, it can be grown as an annual or brought indoors for winter. The leaves can be harvested throughout the growing season and used fresh or dried for tea. The taste is slightly sweet with a hint of bitterness. Some people describe it as similar to green tea, but earthier. The traditional preparation is simple: a handful of fresh leaves or a teaspoon of dried leaves, steeped in hot water for 5 to 10 minutes. The people of Guizhou did not have elaborate extraction processes or standardized dosing protocols. They just drank the tea daily as part of their normal routine. That consistency over decades appears to be more important than any specific dose. You can find Jiaogulan seeds and plants from specialty herb nurseries. You can find dried Jiaogulan tea from Asian grocery stores and online retailers. You can find standardized extracts. If you prefer capsules to tea, the plant is legal everywhere, and it is cheap because no one has figured out how to make it expensive. The research from Asia continues to accumulate. Recent studies have looked at Jiaogulan for fatty liver disease, for obesity, for cognitive decline, for inflammation. The results continue to be promising, and the Western medical establishment continues to mostly ignore them. There is no conspiracy here. There is just economics. Research costs money, and the only entities with enough money to fund large-scale clinical trials are pharmaceutical companies and governments. Pharmaceutical companies fund research on things they can patent. Governments fund research on things that are already priorities. A folk remedy from rural China used by poor farmers does not fit either category. So the knowledge stays lost, passed down through families in mountain villages, published in journals that Western doctors never read, shared on internet forums among people who have learned not to wait for official validation. The people of Guizhou province did not need a clinical trial to tell them the tea worked. They watched their grandparents live past 90 and their great-grandparents live past 100. They noticed that the villages where people drank xian tao had fewer sick people and more elders. They did not know about gynostemma or AMPK activation or adaptogenic properties. They just knew that the vine on the mountainside kept people alive. That knowledge is now available to anyone who looks for it. The seeds cost a few dollars. The plants grow without pesticides or fertilizers. The tea requires no special equipment to prepare. Everything the pharmaceutical industry cannot provide is sitting there, waiting for anyone willing to learn. If this remedy opens something for you, share it with someone who needs to hear it. Another lost remedy is coming soon.